Now we're going to look at the anterior occlusion, the upper incisor, the lower incisor in the sagittal plane. That's front and back. Normally, the upper incisor is more forward than the lower incisor. That distance is called overjet. When you are greater than 5 millimeters, and that can be measured clinically, or if you just suspect that it is greater than 5 millimeters or a large distance of upper incisor to lower incisor, that straight line distance, then we become concerned about the upper incisor being at risk of fracture. And that's why severe overjet is important to counsel patients about. Whenever the lower incisor is in front of the upper incisor, that's called anterior crossbite. Kind of unusual condition, but we see it occasionally, is when the upper incisor is biting right on top of the lower incisor. That's called edge to edge. Not normal, and it suggests that there could be traumatic occlusal contacts. The final plane of space is transverse. Normally we think about transverse as width the face, width of arches, but when it comes to the incisor occlusion, we're focusing on the right and left side, and that's really a story about midlines. So there are 3 midlines. There's the upper dental midline, which is between the central incisors, the lower dental midline, which is between the lower central incisors. They should coincide. And all of these upper and lower dental midlines should coincide with the facial midline. So when you see a discrepancy between the upper dental midline and the lower dental midline, you go through this process all the time because you have to investigate and figure out what's going on. The first thing you do is you say, is there a problem? If they're lining up nicely, there's no problem. But if they're not, you have to ask yourself, did the upper incisor shift? You should be looking at the pattern of crowding in the anterior region, or maybe teeth drifting into an abnormal space, like a missing tooth or a prematurely exfoliated tooth, or some reason, maybe the teeth drifted. The first thing you always look at is the incisors. So did the maxillary incisor shift? Or did the mandibular incisor shift? Or did the whole mandible shift? And that would be called a functional mandibular shift.